Ladies and gentlemen, imagine this. You close your eyes, the lights above blur, and within moments, you drift into a world where time disappears, pain vanishes, and your body rests in complete stillness. This is the power of anesthesia, one of modern medicine's most mysterious yet life-saving miracles. Have you ever wondered what really happens inside your brain, your heart, your very cells during this profound state? Today, we are not just talking about sleep. We are uncovering the science, the mystery, and the truth behind one of medicine's greatest hidden journeys. When we think about anesthesia, often picture a simple act. A doctor gives you a mask, you count backward from 10, and suddenly you wake up hours later as if only a few moments have passed. But the reality is so much deeper, so much more fascinating. Anesthesia is not sleep. It is an entirely different physiological state, one that carefully suspends awareness, pain, and memory while keeping your body alive and stable. It is one of the greatest achievements of modern medicine, but also one of the least understood experiences by patients. When anesthesia enters your body, it begins its journey through your bloodstream, carried like a silent messenger into the brain. There, it gently alters the way nerve cells communicate, quieting the chatter that normally allows your mind to experience the world. Imagine a busy city where every street is filled with honking cars and rushing people. Anesthesia, in a way, turns down the traffic lights, slows the cars, and brings the entire city to a calm, still state. It doesn't destroy the city, it preserves it while temporarily changing how it operates. This is why you lose consciousness, why your awareness fades, and why you can no longer feel the surgeon's hands or remember the hours that pass. Anesthesia is not only about the brain. Think about pain, the sharp warning signal your body sends when danger threatens your tissues. Normally, this is a survival mechanism protecting you from harm. Yet, in the middle of surgery, pain would make healing impossible. Anesthesia travels to your spinal cord, where many pain signals first arrive, blocks them before they can climb up to your brain, creating a silent shield that prevents suffering while allowing surgeons to work. It is like pulling down the shades in a bright room. The light still exists outside, but you are no longer disturbed by its presence. And then there is memory. One of the most remarkable things about anesthesia is its ability to erase the memory of surgery. Think of how sleep works. You may wake up remembering dreams, or sometimes nothing at all. With anesthesia, your brain's memory circuits are carefully interrupted so that even though your body has undergone hours of surgery, your mind awakens as if no time has passed. That gift, that protection of the mind, is one of the reasons patients describe anesthesia as stepping into a void and returning in an instant. While your awareness is gone, your body is not abandoned. This is where the art and science of anesthesiology come together. Every second you are under, your heart rate, your breathing, your blood pressure, your oxygen levels, all are carefully monitored and adjusted. Machines hum quietly, medications are finely tuned, and the anesthesiologist acts as both guardian and guide, ensuring that your body remains in balance. Think of it as a pilot flying through the clouds. You may not see the turbulence, but the pilot is navigating every moment to keep you safe until you reach the other side. Now let us look deeper into the brain itself. The brain is an electrical organ pulsing with waves of activity that create consciousness. Anesthesia modifies these waves, shifting them into slower, deeper rhythms. Scientists studying brain scans have seen how anesthesia resembles neither wakefulness nor natural sleep, but a unique pattern entirely its own. It is a reminder that anesthesia is not a trick or an illusion. It is a true alteration of biology, a doorway into a state that nature never designed for us, but medicine has carefully engineered. Here is something truly fascinating. Not all anesthesia is the same. There are general anesthetics that render you completely unconscious, regional anesthetics that numb only a part of the body, and local anesthetics that silence sensation in a small area. Each type has its own role, its own beauty, and its own science. A mother receiving an epidural during childbirth is experiencing a form of regional anesthesia, one that allows her to welcome new life without the suffering of pain. A patient receiving local anesthesia for a dental procedure feels nothing as the dentist works, yet remains fully awake. And then there is the full surrender of general anesthesia, where time itself vanishes. These different paths remind us that anesthesia is not a single tool, but a spectrum of strategies designed to match the needs of each human body and each moment of healing. But here is a question worth asking. If anesthesia is so powerful, how does your body recover from it? How do you wake up? The answer lies in the way the medications are processed. Your liver and kidneys gradually break down the anesthetic agents. Your lungs exhale certain gases, and slowly, chemical curtain lifts. Bit by bit, your brain's neurons begin to fire normally again. Your memory circuits reconnect, your senses awaken, and you re-enter the world. What feels like an instant to you is actually a carefully orchestrated return to balance, like a sunrise slowly pushing away the darkness of night. For many patients, waking from anesthesia is a profound experience. Some feel refreshed, others disoriented, some even find themselves laughing or crying as their awareness returns. This shows us something remarkable, that anesthesia is not just a shutdown of the mind, but a journey through states of being that touch our emotions, our memories, and our very sense of self. It is proof of how delicate and mysterious consciousness truly is. Let us pause to reflect. Anesthesia has made modern surgery possible. Before its discovery in the 19th century, surgery was a brutal and terrifying ordeal. Patients endured unimaginable pain, and surgeons had to work with speed rather than precision. The introduction of anesthesia transformed medicine forever. Suddenly, surgeons could operate with focus, patients could be spared from suffering, humanity could take a giant leap forward in healing. In that moment, science gave us not just a tool, but a gift, the ability to separate pain from healing, fear from recovery. And so, ladies and gentlemen, when you think about anesthesia, do not think of it as simply falling asleep. Think of it as entering a protective state created by science, guarded by physicians, designed to give your body the chance to heal without suffering. It is one of the quiet miracles of medicine, happening every day in hospitals around the world, unseen and often unappreciated, but vital to saving lives. As you leave with this knowledge, I want you to remember that anesthesia is not just about science. It is also about trust. Trust between patient and doctor, trust in the unseen hands guiding you through the unknown. Trust that when you close your eyes, you will awaken to a brighter tomorrow. That trust is the bridge between fear and healing, between the darkness of uncertainty and the light of recovery. So the next time you hear the word anesthesia, remember the journey that takes place within you, the silencing of pain, the suspension of time, the protection of memory, and the vigilant guardianship of those who guide you through. Remember that it is not merely a pause in your story, but a carefully orchestrated interlude that allows healing to happen. Above all, remember that science, at its best, is not cold or mechanical, but deeply human, designed to preserve life, protect dignity, and restore hope. Ladies and gentlemen, this is what really happens when you go under anesthesia. It is not just medicine. It is a journey into the hidden depths of consciousness and a reminder of how extraordinary the human body and mind truly are. Ladies and gentlemen, comes a moment in every medical journey when trust takes center stage. You lie down, a mask lowers, a medication enters your bloodstream, and suddenly the world, as you know it, disappears. Anesthesia is not just a pause button for your awareness, it is a carefully orchestrated symphony guiding your body into safety while science works miracles. What does this invisible guardian truly do? How does it protect you, silence pain, allow surgeons to reshape lives? Tonight, I will take you inside the fascinating world of anesthesia, where science, mystery, and healing converge. When we think about anesthesia, we often oversimplify it. We think of it as falling asleep and waking up hours later. But anesthesia is not sleep. It is not rest. It is something entirely different, engineered state where the body and mind are gently separated from the experience of surgery. At its core, anesthesia is about creating a shield between you and pain, between your awareness and the work being done on your body. Allows surgeons to perform miracles without you ever having to feel or remember them. Imagine a symphony orchestra, every instrument carefully tuned to create harmony. That is what anesthesia does. It takes over breathing, memory, pain, and consciousness and blends them into a seamless protective state. When the medication enters your bloodstream, acts almost instantly on your brain. Neurons, the tiny messengers of the nervous system, normally fire rapidly, creating thoughts, sensations, and awareness. Anesthetic agents quiet that storm. They slow the firing, change the rhythms, alter the way signals move between brain cells. Suddenly, the chatter that makes up your consciousness begins to fade. Are not asleep in the natural sense. You are placed into a unique biological state designed by science, one where the body continues to live, but the mind is carefully suspended. Anesthesia is not only about turning off consciousness. It has layers like a shield with many levels of defense. First, there is unconsciousness, where awareness vanishes. Second, there is analgesia, the blocking of pain signals so they never reach your brain. Third, there is amnesia, the erasure of memory so that no trace of surgery lingers in your mind. Finally, there is immobility, the stillness that allows surgeons to work with precision. Each of these layers must be carefully balanced, spinning plates in the air, because too little of one or too much of another could put a patient at risk. This is why anesthesiologists are not just doctors but guardians, constantly monitoring, adjusting, guiding every heartbeat, every breath, and every shift in the body's chemistry. Think of the heart. Under normal conditions, it beats with a rhythm that responds to your thoughts, your emotions, even your breathing. Under anesthesia, the heart is gently stabilized. Blood pressure is watched carefully. Oxygen levels are measured every second, and medications are adjusted to keep the body in perfect equilibrium. Think of the lungs. Normally, you take thousands of breaths each day without even thinking. Under anesthesia, those breaths may be taken over by a machine. A ventilator that ensures oxygen continues to flow into your body and carbon dioxide leaves it. You may not be aware, but the orchestra continues to play, each instrument guided by the steady hand of the anesthesiologist. There is the mystery of memory. We all know what it is like to dream, to wake up with fragments of images or sensations. But under anesthesia, the brain's ability to form memories is silenced. Even if your body reacts to a surgical stimulus, your mind will never record it. You awaken as though time itself has been erased. Hours pass in an instant, and you emerge into a new reality where healing has already begun. This gift, the ability to remove suffering not only in the moment, but from memory, is one of the most profound powers of anesthesia. But anesthesia is not a single experience for everyone. It comes in many forms, each designed for a different journey. Local anesthesia numbs only a small area, allowing you to remain awake while pain is blocked in a targeted region. Regional anesthesia, like a spinal or epidural, interrupts sensation in a larger part of the body while leaving you alert. And then there is general anesthesia, the full surrender of consciousness, the deepest level of protection. Each form is chosen with care, matched to the procedure and the needs of the patient. This versatility shows us the elegance of anesthesia. It is not blunt force, but a precise and adaptable science. Now consider this question: what happens when it is time to wake up? How do you return from such a profound state? The medications that created anesthesia begin to wear off. Some are broken down by the liver, others exhaled through the lungs, others slowly fade as the body metabolizes them. The anesthesiologist gently decreases the medications, and your nervous system begins to restart. Your neurons fire again, your senses return, and your awareness blossoms back into being. It is like watching dawn rise after a long night. The light returns gradually, and suddenly you are back in the world, often with no memory of where you have been. This transition is not always the same for every patient. Some wake peacefully, others wake confused, some with laughter, some with tears. These responses remind us that anesthesia does not just interact with biology, it touches the deepest layers of who we are as human beings. It reveals how fragile and how resilient our consciousness truly is. To appreciate the power of anesthesia, we must remember where medicine began. Before the discovery of anesthesia in the mid-1800s, surgery was a nightmare of pain and fear. Patients endured without relief, surgeons rushed to complete their work in minutes, and survival was uncertain. The introduction of anesthesia changed everything. For the first time, surgery could be done with precision. Patients could be spared from trauma, and the field of modern medicine was born. Anesthesia opened the door to complex operations, to organ transplants, to life-saving procedures that once would have been impossible. It is no exaggeration to say that anesthesia revolutionized medicine and transformed human possibility. Yet, despite its power, anesthesia remains a mystery in many ways. Scientists still study how exactly it silences consciousness. We know what it does. We can measure its effects. The deeper question of how awareness arises in the brain and how anesthesia suspends it remains unsolved. It is a humbling reminder that even with all our knowledge, the human mind is still one of the greatest frontiers of science. So, ladies and gentlemen, what really happens when you go under anesthesia? Your awareness is suspended, your pain is silenced, your memory is erased, your body is kept in perfect balance, and your trust is placed in the hands of medicine and science. It is a carefully choreographed dance, a partnership between technology and human expertise designed to protect life while healing takes place. It is one of the most remarkable achievements of our time, unfolds quietly every day in hospitals all over the world. As you think about anesthesia, I ask you to see it not just as a medical tool, but as a profound human story. It is the story of how science learned to conquer pain, how doctors learned to guide patients safely through the unknown, and how trust became the foundation of healing. Every time someone closes their eyes under anesthesia, it is a leap of faith into the hands of medicine, and every time they awaken, it is proof of the extraordinary power of that trust. Ladies and gentlemen, anesthesia is more than medicine. It is a guardian, a mystery, a bridge between suffering and healing, between fear and recovery. It is one of the quiet miracles that reminds us how far science has come and how much wonder still lies ahead. The next time you or someone you love goes under anesthesia, remember this: it is not simply sleep, it is a journey through the most intricate pathways of the body and mind, guided by the steady hands of those dedicated to your life and well-being. That is the true miracle of anesthesia.